Stressors are the demands placed on us. The stress they cause depends both on the demands themselves and on our ability to cope with them, also known as our coping resources. Most research looks at stressors only because resources are more difficult and more expensive to measure, not because they are less important. One approach to measuring stress is counting life event stressors. Life events such as sitting exams, bereavement, changing jobs and getting married are not chronic and cannot generally be modified. But accurate data can be collected on life event history, and this method is widely used to investigate the effects of stress on health and performance. The best known list of life event stressors is that of Holmes and Ray. This social readjustment rating scale ranks a number of life events according to their relative effects on stress and health and allows a build-up of stress over time to be calculated. This and other scales like it allow researchers to find correlations between stress, behaviour and performance. Behavioural patterns such as irritability, hostility and apathy are often caused by stress, but the key clue that someone is overstressed is that change in their behaviour. Alcohol or tobacco use, apathy, absenteeism or carelessness in someone who normally does not show these behaviours can be an indicator of stress. It is the change in emotional patterns that is most suggestive of a stress reaction. So too with emotions. Stress-induced emotions are part of our stress coping resource and are positive such as determination, concentration, pride in success. But when stress exceeds resource, negative emotions including cynicism, depression, anxiety and irritability are increased. Holmes and Ray's scale was used in the 1960s to study the pattern of stress that preceded the onset of symptoms in patient groups and controls. Patients with heart disease, tuberculosis, skin disease or pregnancy were all found to show clustering of stressors in the 2 years preceding the onset of their symptoms. In a prospective study, Holmes and Ray used the scale to measure stress in the crew of a US Navy ship and found that crew members with over 300 points in a 6-month period reported a third more illness to medical staff than those scoring under 100. Most of these illnesses were minor and there was no proportional difference in illness severity between more and less stressed crew members. The social readjustment rating scale and disease correlations have been revised numerous times since the 1960s, but always with broadly similar findings that cumulative stress is associated with the onset of disease. Although stress has numerous associations with disease incidence and severity, some caution in interpretation is necessary. Ill health is a major stressor, and associations between stress and disease may be because a disease causes stress rather than the other way around. Another problem is that the sections of society most prone to ill health also tend to be those who are most prone to stress. Low socioeconomic status, for example, is associated with both. However, chronic stress seems to cause a non-specific depression of defence mechanisms. It is associated with an increased risk of cardiovascular disease, but its most pronounced associations are with the exacerbation of existing disease. Stress causes cancer to behave more aggressively. Whether it has an influence on the risk of cancer is less clear, but there is some evidence that it increases it. Numerous other diseases also show this effect. Stress is associated with worsening control of inflammatory bowel disease. It has a significant effect on the time it takes for wounds to heal, which is extended by around 25%. It delays post-operative recovery in general. Few surgeons will perform non-urgent surgery on patients who are highly distressed or frightened for this reason. Tuberculosis has also long been known to be related to the state of mind, with a positive, optimistic and cheerful outlook being associated with faster recovery times. The long-standing concepts of fighting off a disease and dying of a broken heart date from the time when mortal disease is characterised by a chronic balance between body defence and disease progress were common. Among these diseases, tuberculosis and leprosy are currently seen as chronic diseases in which progress is sensitive to stress. Other conditions such as syphilis are now easily treatable, so recent data on the behaviour of the chronic condition does not exist, but is likely to be stress sensitive. The closest and best described disease associations of stress are with mental illness. Both anxiety and depression can be provoked or exacerbated by stress. In the majority of studies, these relationships between organic conditions and stress only account for a minority of stress-related ill health and loss at work days. The most common manifestations of stress are symptoms that resist diagnosis on objective testing, such as tension headaches, chronic fatigue, irritable bowel syndrome, and atypical chest pain. Also, there are very common conditions whose clinical manifestations are highly variable, like arthritis and spondylosis, symptoms of which are highly stress-dependent. Experimentally, high levels of stress have been found to impair short-term memory, decision-making, forward planning, and prioritisation. Prioritisation is especially significant because it reflects the situation we all recognise. High levels of stress reduce our ability to see things in proportion. Stressors often cause people to concentrate on things obsessively, so they will fail to see the true importance of the stressors themselves in the fuller context of their lives. We'll have a closer look at the relationship between stress and performance in the next video.